Ladies and gentlemen, my talk is not all leg pain is sciatica. Sciatica is just a symptom. It is not a disease because of the pinching of the sciatic nerve and causing the leg pain and the paresthesia. Sciatic is the biggest nerve of the body originating from L4-5, S1 to 3, and the typical feature is the low back pain going down the leg, along with paresthesia and the weakness. And the first thought which comes to our mind when we see this kind of patient is the lumbar disc. But we should be very cautious because there are a lot of mimickers. And like in this case, the patient's husband was shoving the MRI to me and saying, "Sir, she has got the lumbar disc herniation, which is causing her leg pain for the last 6 months."
She's about 50 years old and she has been treated for her leg pains. Zara chal ke dikhaiye. So, because MRI of the spine and she has been having leg pain and very mild back pain.
I'm sorry, the sound was on. But when I saw this case, her typical limb was not showing that she has got a spinal problem. She had an osteoarthritis of the left knee, and that was a problem. Similarly, the next case, I'm sorry, that voice, can you put that voice off? The next case, this lady had a pain in the back, which was going down her right leg, but only up to the knee. And clinically, her SLR was positive, and her figure of 4 test was also positive. So I didn't know whether it was a lumbar disc or it was a sacroiliac joint. Now, she had a lumbar disc herniation at L4-5 and L5-S1, but at the same time, she had edema of the SI joint as well. Now, I was at the haunts of dilemma what to do. See it here? You see the edema of the SI joint? I injected her SI joint with a steroid and analgesic, and she became fine. So, we should be extremely careful.
On the right.
Now, the leg pain can be because of the local pathology or the referred pathology. In the local, the most common is the hip joint. Patient generally comes with the crutches, a limp, a groin pain, and which is more on internal rotation. So this pain can be because of anything inside the joint or outside the joint, like trauma or arthritis. Outside the joint, trochanteric bursitis, all of us know. Local tenderness going down the leg. Now, this was an interesting case. SLE patient with typical L5 dermatomal pain going down the dorsum of the foot. The hallux was weak and MRI was normal. Luckily, we got a MRI of the pelvis and she had bilateral AVN. So, now the hamstring trauma can cause the tightness and it can confuse with a spondylolisthesis. This patient was a runner and came to us with a leg pain. We thought that maybe he had a stress fracture, but it came out to be an adamantinoma. So any tumor in the leg can cause pain and paresthesia in the leg. So we should be worried of that too. SI joint dysfunction is quite common. I play tennis in the morning and I must have injected at least 10 players who play with me and most of them are happy. So this is a very common sports injury because of strain and ankylosing spondylitis. This is a very early feature. Pregnancy, infection. It is as common as 43% in the post-lumbar fusion patients and 22% of all the backache patients. Underdiagnosed. Symptoms are simple. You've got the back pain, you've got transitional pain. If you are not able to prove anything, the best thing is you go in and give an injection in the SI joint. That will be therapeutic and diagnostic. Similarly, our rheumatology friend, fibromyalgia, a very common thing. So the patient will have some tender points and the trigger points. And to complete the list, the cluneal nerve entrapment, although I've never seen it, maybe I was not so meticulous. Now, Piriformis syndrome is quite in fashion, but it is very difficult. Even MRI will not help because the sciatic nerve comes out of the pelvis beneath the piriformis or sometimes through it. The very interesting tests are there can be a local tenderness, or if you pull the knee to the opposite shoulder, you will stretch the piriformis muscle and it can elicit the pain. Or piriformis muscle being an abductor and external rotation. So if you tie it tape like this, and if you keep doing it and you do an exercise, maybe it can elicit the pain. Now, facet joint, again, the morning stiffness and pain, and you don't know. So the best thing is facet block. or the medial branch block. This will settle down the issue, and this will be therapeutic as well. Now, peripheral arterial disease or the venous, arteries and veins, both on obstruction can cause pain in the leg. We all know that DVT can cause the pain in the calf, which is tender. Arterial disease, the typical claudication, but unlike the spinal claudication, the patient gets better when he stands, whereas in the spinal stenosis, he will only get better when he will sit down and lie down. And the peripheral pulses will be weak. There will be skin changes, maybe up to gangrene. So ultrasonology, you all know, and angiography will settle down the issue. Now the most common, peripheral neuropathy, diabetes. The main feature is it is symmetrically found in both the feet. It is typical gloves and stocking, and upper limbs are also, in this case, involved. Now, tarsal tunnel, people don't know it, but this is pretty common. You can have the entrapment of the posterior tibial nerve, which can cause pain going down the foot. So the meralgia paresthetica. But I always get my MR to rule out L23 and L34 disc, herpes zoster. Now, the common causes which compress the sciatic nerve. Lumbar disc herniation, SLR is positive, corroborate with the MRI. DTT, the osteophyte can compress the nerve. Spondylolisthesis, we know it can cause the leg pain. Spinal stenosis, we know, typical claudication, that's why patient prefer to band in front. Now, this was an interesting case with a hip pain going down the leg, and it turned out to be the conus tumor. So any tumor in the spine, malignant or otherwise, I'll tell you the story. About 3 days back, I got a female who said that I've got a pain in my leg for the last 1 month, and her MRI of LSS spine was normal. So I got a screening, and I found that there was a tumor in the neck. So if you got a doubt, just go for a screening. And the facetal cyst can cause this, and this funny looking AVM. And intrapelvic tumors can also cause the. So, ladies and gentlemen, the message is that all leg pains are not because of the disc. MRI can be misleading because 30% of the normal persons have got abnormal MR findings. So just keep your mind open and consider wider differential. Thank you.